a comparatively newer hospital. So we had an advantage that we had anyway in our plans invested in technology, in network and newer work processes as compared to some of the older established hospitals. So in that way, I think we were probably just at the right time at the right place in terms of delivering some of these service standards to the patients who were expecting these things during the pandemic. So just to give you an example, we were among the few hospitals, at least in this area, who were extensively using HIS and EMR. Our aim is to actually be a paperless hospital, and we are moving in that direction. So many of these things were part of our initiatives, and this is actually evolving. So the advantage is now the stakeholders are also receptive in terms of improving many of these processes. So it helps everyone in the system. Another initiative, we were among the first hospital in India who had a sort of a smart ICU concept, where we have a backbone of a technology where our ICU is not only supported by foot on the ground by specialists, but also super specialists who are kind of manning our ICUs using the best of technology, the remote cameras usage, the remote data analysis. So that way, I think we got access to the best of talents in the critical care and super specialty care, where our ICU patients get the best of the advantages. We also use technology and expertise to actually spread awareness about cancer to much wider population, and digital media and digital medium actually plays an important role in this. So say one thing would be the patient centricity would be our core focus area. In fact, it is an integral part of our entire philosophy. So when we talk of technology, I mean, the focus would be to leverage technology at maximum, but not at the cost of losing the human touch in that entire system. So we always say humanizing the healthcare is our motto. So priority would always be to have a smart and data-driven tech platform which can leverage the data generated from our own internal day-to-day operations, and we can optimize the operations by bringing the entire learning by using some of these data insights and even the feedback that you spoke about. So it's something like learning while working concept that we're working on. Also, we are extremely keen to be part of global research industry, especially the clinical research industry, and because we really feel that research is always forward looking. If we are part of the global research industry, and if we leverage the research data and the research network, it will ultimately benefit the patient, because the patient, the stakeholders, the doctors, and even the hospital, they all benefit by being part of this entire drug development industry. And finally, we would also like to support the Indian healthcare system with our own sort of expertise which is available by using the technology. So, for example, we are extremely open to provide the expertise available with us by providing the virtual tumor board availability. Anyone who wants to leverage the expertise available in the cancer care, it's already available. We are also extremely keen on building networks with the stakeholders who are trying to build up smarter systems, including the betterment of the HIS systems out there, because we have got the learning, we have got the expertise. So I think collaboration is something that we are very keen in this healthcare space.
For more updates from CXO TV, please like and subscribe to our channel.